Thank you for choosing MedStar Health Home Care. This short video will explain what to expect when a doctor orders in-home healthcare services for you or a loved one. Sometimes, when patients go home after staying in a hospital, nursing home, or rehabilitation center, they still need help and medical care. A doctor or other approved provider can refer these patients to MedStar Health Home Care. Individuals may also be referred to home care after a doctor's office visit when the provider recognizes that the patient needs in-home medical help due to a disability, a medical condition that is hard to control, or a chronic illness. MedStar Health Home Care sends licensed healthcare professionals to check in on patients during regular home visits. They provide medical care, treatment, and therapy to help patients recover safely at home. Now, let's talk more about what patients can expect. There are several types of in-home healthcare services that a doctor may prescribe. For instance, the doctor may order nursing care. Our nurses do things like help the patient understand their medicines and keep them organized, teach patients how to keep bad symptoms from getting worse. Nurses may talk with patients and their caregivers about healthier eating habits or moving around more. They may demonstrate and teach how to change wound bandages and how to spot symptoms of infection. A nurse can also teach patients and their caregivers how to do IV therapy, medications, or nutrition at home. A nurse will not visit every day, so these are important treatments that we teach patients and their loved ones to do themselves. Patients receiving home care services can also get help from a home health aide. Aides assist patients with personal care needs like bathing, grooming, and other activities of daily living. Aide visits generally last less than 1 hour, and they visit just a few days a week. Depending on the patient's needs, a doctor may also order in-home rehabilitation services, like physical or occupational therapy, or speech and language pathology. Therapists work with each patient to create a special home exercise plan. They help patients build strength and improve their ability to move around. A therapist will also do a home safety assessment and recommend ways to prevent falls and fall injuries. Therapists help patients figure out how to get back to doing their normal activities again. Lastly, our speech and language pathologists help patients who have a hard time speaking, thinking, swallowing, and solving problems. Speech therapists observe patients and their daily struggles so they can teach them ways to overcome their challenges. MedStar Health Home Care also offers medical social workers. Medical social workers assess a patient's ability to live safely and securely in their current environment. They may help a patient or their caregiver find support in the community, like Meals on Wheels, adult daycare, or local resources for seniors and the disabled. Now I want to tell you about some important guidelines that home care companies must follow to provide safe and effective care for our patients. First, home health care must be ordered by a doctor or other approved provider. The doctor or provider must be willing to oversee a patient's ongoing home care treatment. We work closely with our patients' doctors to keep them informed about their patient's progress. The treatment plan and medications are updated as needed according to the doctor or provider's orders. Sometimes it takes us longer than expected to collect all of the documents we need from the doctor, or we may be waiting for the insurance company to approve services. This can delay how long it takes to get home care started. If you experience a delay, please call us at 1-800-862-2166. Next, home care is specifically for patients who have a difficult time leaving home. For instance, patients may need help from another person or medical equipment like a walker or a wheelchair. Usually, home care patients are only able to leave home for doctor's appointments or grocery shopping. However, Some insurance companies are not as strict with this requirement. Home health care is not long-term. When home care services begin, we talk with the patient, caregiver, and members of the healthcare team to set goals for improvement. Then, we work together to achieve the goals during home care treatment. When the patient improves and reaches the goals, home care services come to an end. Typically, home care lasts 4 to 8 weeks. When home care ends, patients may still need to look for local places where they can receive ongoing medical care. This could be an outpatient therapy center or a wound clinic. Home care is part-time and intermittent. Patients typically receive visits just a few times a week. Sometimes it may be once weekly or monthly. And visits usually last around 30 to 45 minutes. It really depends on the patient's specific treatment needs and the doctor's orders. However, our first visit, which we call the admission visit, can take up to 2 hours. This is an important visit because we review all of the patient's health history and other information to make sure everything in our record is correct. We ask questions to learn about specific healthcare needs and to better understand the patient's goals for improving and feeling better. Then, home care team members will talk to the patient and caregiver to ensure everyone agrees on the plan for the patient's care, which includes how often we will visit. Now, it may seem like each team member asks the same questions on every visit. Please know that this is for patient safety and to ensure our records are correct. Asking the same questions also helps us to track the patient's progress over time. Now, let's talk about how we schedule home visits. A home care team member will call you to schedule your home visit. They usually call the evening before the planned visit or before 9 a.m. on the morning of the visit. Please be sure to answer your phone and listen to voicemail messages. The call may look like an unknown caller or a solicitor. The nurse, therapist, or aide will give you a window of time when they will arrive. For instance, they may say, "I'll be there between 10 a.m. and noon." We give an approximate time because there are a number of things that can delay our arrival, like traffic, parking issues, or the prior patient may have had an urgent medical need. We appreciate your patience when these delays occur. Lastly, it's important for you to know that we want to protect your privacy. Due to federal privacy regulations, healthcare companies must be very careful when we handle private health information. This includes who is legally allowed to receive details about a patient's care. Often, we need specific permission from the patient to share information, even if it's the patient's close family members. Privacy guidelines also apply to how we communicate with you. For instance, we can communicate with you using text messages, but texting is not secure. We cannot share any private information via text. However, we can use text messages for things like scheduling visits. At MedStar Health Home Care, we want to make sure you have a great experience as our patient. Our goal is to help you heal, to regain the ability to live life independently, and to prevent medical emergencies and stays at the hospital. We want to help you live safely and in the comfort of your own home. If you have any questions about your care or any of the information shared during this video, please ask one of the home care team members who will visit you. Thank you for trusting MedStar Health Home Care. We wish you all the best. If you feel like we are not giving you our best, please call us at 1-800-862-2166.